Hello, my name is Daniel Higgins, and I'm an infectious disease epidemiologist here at Maine Medical Center. I'd like to thank you for your time today, and I'd like to talk to you about the new diagnostic imaging used to test for Ticehurst disease. So, a little bit about Ticehurst disease. It's a bacterial disease caused by the bacteria Ticehurst athanis and has an incubation period of 7 to 10 days. After the incubation period, clinical symptoms begin to appear, which range from hypoxia to pericarditis. As we can see, hypoxia is defined as less than 90% of room air and will likely require a supplemental O2. Tachypnea, which is defined as a heightened respiratory rate greater than 20 breaths per minute. A pruritic and diffuse purple truncal rash, predominantly on the back. Respiratory depression. And once again, pericarditis. The newly developed diagnostic test is called the Ryan imaging test. Normally, to test for Ticehurst disease, we would use an X-ray, which here we can see a pericardial effusion, which is one of the key features of Ticehurst disease. However, X-rays are expensive, and in addition to being expensive, they also expose patients to radiation. The Ryan imaging test is designed to be inexpensive and relatively painless. It's aimed to be costing a total of $250 per patient, and the most amount of discomfort comes from the injection from the newly developed Ryan dye solution. After the patient has been injected with the dye, 10 minutes pass in order to stain the bacterial colonies, and the patient will subsequently get a thoracic Doppler ultrasound. Positive diagnostic test is indicated by dye uptake by the bacterial colonies in the pleura of the lungs and the pericardium of the heart. Here we can see some dye uptake in the pericardium of the heart as the arrow points to it. In order to assess the efficacy of the Ryan imaging test, we decided to collect a small amount of data on a population of 10,000 individuals. Here you can see true positives, true negatives, false positives, and false negatives. To further understand the statistics and the validity of the Ryan imaging test, there are several statistical analyses that were performed. Prevalence being the percent of the population that had the disease, sensitivity, specificity, positive predictive value, and negative predictive value. So here are the interpretations from the results. The Ryan imaging test is 91% sensitive to positive cases. This makes the imaging test an adequate test for diagnosing the disease, as in the diseased cohort, 91% of the population tested as true positives. One thing to note, however, is it has a low specificity rate of 16%, and this is due to the fact there are low true negative values with many false positives. Furthermore, the Ryan imaging test also had a low positive predictive value of 15% and a high negative predictive value of 92%. This suggests that only 15% of those who tested positive for the disease actually had the disease, whereas 92% of those who tested negative truly did not have the disease. Ultimately, this is a sensitive test that is accurate in identifying Ticehurst disease in the positive cases, but does also have low specificity given the high amount of false positives. It will, however, diagnose the strata of the true negatives from the negative results. So if you have any additional questions, please feel free to email me, which is right here, and we will continue to publish updates with additional information as we continue to learn more about Ticehurst disease on the Maine Medical Center website. Thank you so much for your time.